Hey everybody, Dr. Barron here with virtualheadachespecialist.com. I want to talk today about rebound headache or medication overuse headache. This is a major issue that I see all day long, every day in the headache clinic. It's something that will prevent your headaches and migraines from ever getting better as long as you are stuck in this pattern. This requires a history of migraine. So, if you have a history of migraine, even if it was years and years ago, we know that you have the electrical circuitry to have migraine, and it can reactivate really at any point. So history of migraine, and if you're using certain medications at certain frequencies, you can get stuck in rebound headache. So what medicines do that? First of all, over-the-counter medications, anti-inflammatories, Motrin, Tylenol, Excedrin, Aleve, all these kind of things over the counter. If you're taking it more than 10 days per month on average for 3+ months, you can evolve into chronic migraine and worsening headache over time. Triptans, ergots like DHE, also more than 10 days a month is the magic number. If you're taking more than that, the migraines will often evolve from episodic into more and more higher frequency, eventually chronic migraine, and you're miserable stuck in that cycle. Triptans cause a really nasty rebound headache as well if you're taking too much of them. Opiates, opioids, Percocet, Norco, oxycodone, even the synthetic opiates like tramadol, 8 days a month or more will move you from episodic migraine into chronic migraine and worsening headaches. The worst offender is actually one called Fioricet, Fiorinol. Butalbital is the generic name of this medicine. This is also, we call this the headache specialist's worst enemy, and for good reason. It's really miserable trying to get patients off this medicine. The magic number for this, if you're taking it more than 5 days per month, will really increase your risk of evolving into chronic migraine and chronic daily headache. And unfortunately, there's no way out of that until you detox from those medications. I want to highlight the fact that the Gepants, the newer medications that are out there, like Nurtec, Ubrelvy, Zavspret, these actually do not have rebound potential with them, which is a huge bonus of those medicines. So how do you get off of these medications? Well, there's a number of ways to do this, and really the best way to do it is with your doctor, coming up with a good strategy. One easy way that I talk to patients about doing this is that I say every week, take away 1 day out of that week that you're not using the medication. So, say you're using 6 Excedrins a day. For that first week, maybe drop it to 3 Excedrin a day. And then each week after that, try to get rid of 1 day out of that week until eventually you get down to about 10 days a month or less optimally. Now, a couple things to keep in mind. You do not want to cold turkey some of the medication. So you don't want to cold turkey opiates. You don't want to cold turkey butalbital medicines like Fioricet, Fiorinol, because if you're taking a lot of those, there's a barbiturate in Fioricet, and you can get withdrawal seizures. So it's a really nasty medication. I see patients all the time that are just stuck in years of daily headache, and I explain to them that this Fioricet is why you're here, and they don't like to hear that. And the point is that you're here because you have daily headache, and they say it's not from that, but yet you're having to take this every day. So patients don't like to come off this medicine, but it's something that has to happen, unfortunately, if you want to get better. And if you don't, I tell patients, if you want me to give you this medicine, it's kind of like a cardiologist prescribing a high blood pressure diet, but giving you a prescription for salt tablets. So, it's just making the problem sustain and worsen over time. So I do have a blog about this topic in my website, virtualheadachespecialist.com. You can search it out, and it goes into a lot more detail. All right, guys, talk to you later. Bye.